My name is Ashton Millette, and I am our Aware Coordinator here at the Texas Education Agency. I want to definitely welcome everyone to our Mental and Behavioral Health webinar session on the Texas Child Mental Health Care Consortium. And on behalf of the agency and our whole team here in our supportive schools division, I'm definitely wanting to say that we're glad that you all took the time out of your day to join us for this phenomenal learning experience. It's going to be super action packed, and we'll be able to hear from some folks in the field and our great team here at the Texas Child Mental Healthcare Consortium. So today's session, we of course have some presenters from the consortium, but we also are going to be sharing some information about a free mental telehealth program called the Texas Child Health Access through Telemedicine, or some of you all may have heard it called T-Chat before. We also have a pretty phenomenal panel today made up of representatives from health related institutions and actual folks from school districts, just like many of you all. One big thing as well, the session for today is going to be recorded, and I'm going to actually put in the chat the link where you can find our recording after the session today. And then we'll also put up the resources that we'll share as well. And then you all should have taken some time before we got started to fill out the pre-survey training link. But I will also put it in the chat one more time. But you can feel free to use that link or take your phone out and use the QR code to be able to do our pre-survey link as well. But this is something super helpful for us, again, to make sure that we're delivering the best webinar sessions that we can to you all. And then also to showcase our work that we're doing with our funders from the Substance Abuse and Mental Health Services Administration, or SAMHSA. And then also make sure that you put T-Chat in the box when they ask you for the name of the training. And then one other quick piece of housekeeping is that we are using a webinar format today. So that means that participants will not be able to share their video or their audio, but we definitely encourage you to use the chat function to say hello or what's up to your folks that are on the call today as well. And then if you want to ask us or any of our panelists, presenters, any questions, you can definitely use our Q&A function, and we'll do our best to get around to answering them in a moment, or even during our live Q&A session with our panelists later on today. So definitely become familiar with that Q&A function and the chat function as well, because we'll be dropping some resource links in the chat throughout the day too. Another small piece of housekeeping is that we will provide 1.5 CPE credits for educators for today's webinar session. And that'll be for those who attend the full live session. A CPE certificate will be sent by the end of the day. I'm sorry, by the end of the week to the email address that you register with. And also, this will be the only way to get your certificate is doing the live session and not the recording. And then now I am actually going to pass it over to my good friend and colleague, Dr. Molly Lopez from the Texas Institute for Excellence in Mental Health at UT Austin. She'll do a little framing for us today, today's session, really showcasing the areas of a comprehensive school mental health system that today's session will be touching on through using our Texas School Mental Health Framework. So I'm going to go ahead and pass it over to you, Dr. Molly. You can feel free to share your screen to help frame us up for today.
Thank you so much, Ashton, and welcome everybody. Good morning. As Ashton said, my name is Molly Lopez. I am with the South Southwest MHTTC. We are a training and technical assistance organization funded by the Substance Abuse and Mental Health Services Administration, and we serve a 5-state region, with Texas being our largest state in the South region. So super excited to be with you today. I'm going to put up on our screen our wonderful Texas School Mental Health Framework right there. So this provides sort of that big overview, nice overview of the essential components of a comprehensive school mental health system in our state. And so As you look at this, we think about those clouds as really representing those essential core pieces that we want to think about our school systems having in place. We've structured that around a three-tiered schoolhouse there, representing kind of how we think about that public health and public education way of providing services to all students, to students who may have be at risk for some needs, and then those who may need particular intensive needs, whether that's around health, mental health, behavior, education, academic concerns. That's kind of our general structure. And so, as we talk today and as you listen today to the speakers, I want you to be able to think about how this work fits within your comprehensive school mental health system and these essential elements. When we think about kind of what we're going to hear about today, we're going to hear a lot about this particular element where we want to make sure that our students have access to mental health interventions, to services as early as we can possibly get it to them. So that's going to be one of the core elements that we're going to be thinking about. But it's not the only one, right? These elements are interrelated. They interact with each other. So some of the other key elements that I want you to be thinking about are things like where might we have access and supports around substance use intervention, supporting our students who may be at risk or have some of those risk factors, or even have treatment needs around substance use. How are we supporting our students who may be experiencing grief or have experienced trauma and making sure we can get appropriate supports to them? And how are we helping to build those skills within our students to have strong relationships, to be able to manage and recognize their emotions and use all of these skills to make good, healthy decisions? And then the other component to think about is how is this work that we're doing and all of these supports that we're putting in place helping to build that positive, safe, and supportive school climate, right? That those supports that we're able to wrap around students help build that school climate. So all of those things are interacted. And then at the bottom of our graph here, we also have the path to quality school mental health system. So thinking about the structures that we want to put in place to make sure that our mental health system is working well within our schools. So some of the things to highlight here as we move into our discussion, thinking about kind of our school needs, what do our students and our campuses need, and how do we map resources that are available to us to those needs, right? So thinking about where does Teach Chat fit in our students' needs, and how do we make sure we've mapped that well to make sure that students and families have good access to services like you're going to hear about today. We also think again about our tiers of service. So how are we supporting mental health promotion and prevention, which we usually think about kind of as our tier one services? And then how are we supporting that access to specialized services and early intervention care, our tier two and our tier three? And then lastly, I want to highlight as we're thinking about the services that you're going to hear about today, we all know that figuring out how to make things within our school mental health system um, fundable, right? How do we do this work with what's usually very limited funding, and really ensure that we can have sustainability of the services that we put in place? Well, community partnerships and partnerships with organizations that are doing this work is a great way to create, a sustainable system that can continue to go on and support our students and our educators in our schools. And the last thing I want to highlight here is around professional development and training, because we know too that being able to ensure that all of the staff across our school systems have the professional development that they need to support students is an important piece of that. So I'm hoping that our friends here today will also share a little bit about how they might play a role in some of that professional development that you're working on today. So I'm going to pass it back, but just thank you all for being here and thinking about kind of how all of this work fits into the comprehensive school mental health system that you have at your district and campus and how you can continue to build and grow.
Thank you so much, Dr. Lopez. We appreciate that. And if anybody is interested in that graphic that she shared, the Texas School Mental Health Framework graphic, I did put a link into the chat that will lead you to that. It'll lead you to our schoolmentalhealthtx.org website. So without further ado, let's get started. So I'm going to hand over the session now to Rachel Jew, who's the project manager for the Texas Child Health Access through Telemedicine, or TCHAT, and is at the University of Texas system. So I'm going to hand it over to Rachel to find out more great
Good,
information.
good morning, everyone. Very happy to be here. Thanks for having us. As Tammy said, my name is Rachel Jew. I am the consortium's project manager for our TCHAT program. And today I'll be giving just very brief remarks about our TCHAT program in general. You'll see in the presentations that follow that we have a lot of great work happening across the state, and our program is administered by 12 health-related institutions of higher education, and they run their programs slightly differently based on the geography and particular needs of students in their regions. So you'll get to hear a little bit more about those nuances. So just a little bit of background about the consortium. So the consortium was established in the 86th session of the Texas legislature to leverage the expertise and capacity of our health-related institutions. I'll call them HRIs moving forward. And that's really to address, our urgent mental health challenges and improve access to care. We also were established to enhance our ability to address the mental health needs of children and adolescents through these collaborations with our HRIs. So the consortium has a number of programs under its purview. TCHAT is the largest program, and that's really our direct care focus for children with mental and behavioral health needs. So these are the main elements of the program. Our services are free regardless of location across the state. We provide direct telepsychiatry or counseling to students, and we're primarily a school-based program. We also have an education and training component to our work, and so this focuses on school staff, but also students and families. And then we maintain a statewide data management system, and I'll get into that in a minute. Our schools do interact with our data management system to help facilitate referrals. So this is just a brief overview of how services work. We first want to make sure that we have an agreement, that our HRIs have an agreement with each school in their catchment area to provide TCHAT services. So we make sure that the MOUs are signed, and then a district lead is assigned to help identify school staff who will be our main points of contact for the TCHAT program. And you'll hear from them in a minute too. Then we begin onboarding the school. So after those school leads are identified, primarily those are school counselors, they'll be set up within our data management system that's called TRAIT to submit referrals. And as needed, we'll provide technology like iPads to the schools where we will have a presence and where it's needed. Then we can begin service provision. So a student will be identified, and school staff will enter that referral into our TRAIT data management system. And we want to make sure that we get verbal consent from the family to start. But our staff once the referral is received, we'll facilitate getting those formal consents. And I'll pause here just to say again, every HRI is different. So you may have a slightly different experience. We are, we're not even 4 years old. So still going through the implementation phase of the statewide rollout of this program. And we are in the midst of identifying where we can identify some best practices and lessons learned to date with our program, and really attempting to create some cohesion between our HRIs and ensure that our service offerings are consistent statewide. So in the next couple of school years, you might see some changes to some of our programs. After the paperwork is completed, then we'll have an intake session with the student and their family. And then we'll offer an average of 5 sessions to the student and ensure care coordination connection to community services when needed. So we really are focused on that non-urgent, short-term early intervention. Here's just some data about the program through the end of October. We cover just over 3.7 million lives. We are active in 739 schools, just under 5,900 campuses. That 3.7 million number represents 68% of all of the students across the state. And then our satisfaction is really important to us. We make sure that we facilitate family satisfaction, that we get information from our families about how effective the program has been for them. So 88% of our families have reported satisfaction with services, and 84% report that their child is doing better after T-Chat. On our website, I included a link down here. You can find an interactive form of this map, and that's updated monthly. This data is as of October, so you can see where we're active across the state. So we cover quite a bit of the state, but we want to cover 100% of all schools eventually. So if your school or district is not yet enrolled, we really hope that after this presentation, you can work with us to get more students access to services. This is a graphic just by education service centers, so you can see enrollment levels. The green bars are the percent of schools that are active within that ESC. We do have some districts that decline. Those are in black. About 40% of our districts that decline to do so because they have existing mental health services available to their students. And just because a school declines does not mean that they can't become active later. So we really work hard to maintain communication and outreach with all of our schools. This is just a graph of the growth over time. So you can see we have made very incremental and exponential growth since we started. In terms of the graph will show the number of referrals just for the calendar year 2023 through the end of November. You'll see that we have a dip in the summertime. That's typical for us as school is out, and we don't typically get as many referrals. But then once the school year picks back up, we'll get a lot of referrals. We have received over 45,000 referrals, and the ages of referrals are more or less even across age range. So 34% of our referrals are elementary age students, 30% are middle school, and 30% are high school. This will show you the number of sessions and students served. So the number of sessions is the line, and students served are the bars. The colors represent each of our HRIs. So we've served just under 23,000 students and held over 106,000 sessions. And you can see that November was a record for us just in terms of the number of sessions that we held. And then I'll just wrap up my portion of the presentation with a quote. It's always nice to hear what families are saying about TChat. So this parent said that they're so grateful for the program, and you can see the impact that TChat has had on her daughter's, in addressing her daughter's needs. I will pass it on to Dr. Hannah Garza now.
Thank you so much, Rachel. I appreciate that. Good morning, everyone. And before I actually begin, I want to thank everybody for being here. I want to thank everyone for having us. That's a privilege for us, and I'm very, very thankful that we're able to share about our program, because TChat does a lot of amazing things, and we serve many different areas, and we help a lot of different kiddos, and we want to continue doing what we're doing, and we want to continue growing, and we want to continue doing amazing things, and be able to serve as many kiddos as we possibly can, because kiddos, we are their voice, and we want to be able to help and make sure that they are successful, they able to continue growing emotionally, mentally, physically, and we want to be that support for children and for adolescents, to allow them to be grow and be able to become successful members of society and graduate and go in and go to college and do amazing things, and be amazing people. So we are here in TChat El Paso. We are located in El Paso County. I think El Paso is a unicorn of Texas because we are in Mountain Standard Time. Everybody else is in Central Time. So we kind of little unicorn here in the corner. I always like to say that because we are just kind of like in a little bit corner, but we serve a very, very large area, and we actually we got our funding. I know Rachel covered that, but I always like to kind of go over it a little bit. We got our funding back in the end of 2019. I was the first employee hired along with Dr. Martin and Miss Adrian Harrell. We were three trailblazers. Working in the very, very beginning of 2020, and it was amazing to be able to build this program and to be able to work and collaborate and establish MOUs with so many different school districts. We serve a very, very large area. Even so, El Paso is a small team or smaller team out of all of them, but we actually serve a very, very large area. Thank you so much, Rachel. So this is the map of the area that we serve, the coverage, and we actually cover 16 counties, from El Paso County down to Maverick County, where Eagle Pass is, and we are we are responsible for 36 school districts, and we also work with quite a few charter schools that are also located in those counties. And we currently are at 30, we serve and we provide care and help in 30 independent school districts. We serve a large number of children and adolescents, and we also have 5 actually charter schools that we also assist and work with. So we serve in many different areas. In 4 years, the growth was huge, and the area is very, very large. But we are still growing and we are still developing. And we're no longer a toddler. I think we kind of grew a little bit at that point. So we definitely want to continue growing. We definitely want to continue providing that care in many, many different counties and many different areas and school districts. And we always want to continue. We always continue with that outreach to some of the school districts and tell them what are we doing. And a lot of times it's actually super, super helpful, because a lot of times one school district where we're already providing services, they sometimes help us, and with other school districts who are in the area, and they're like, hey, they're doing such amazing job, you need to connect. So when we connect, they tell us, you know what, we heard about you, let's go ahead and sit down, let's talk, and let's do, and let's continue, and let's partner together. So that's been also very, very helpful. So I want to thank for to all of the school districts that we partner with for the amount of work that they also put in. School counselors are amazing, and they step in every day, and they partner with us, and they help us, and they refer kiddos to us, and they talk to families about what we do every single day. So that's also very, very helpful to us, and I'm very, very thankful. I have one of the school counselors that I've been working with for almost partnering for almost 4 years, and she was very, very gracious to join us also today, to be able to talk from her perspective how it is, how our partnership works, and the collaboration, and being able to provide those services also from her perspective, because perspective of schools are very, very different of ours. So that's one of the things that this is our area, and one of the things that we do. Can I? Oh, thank you so much. So one of the things that I wanted to mention is TChat does not, specifically here in TChat El Paso, we do not provide crisis services. And crisis services meaning when someone is actively in crisis, when someone is actively experiencing suicidal ideations, when someone is actively experiencing homicidal ideations, when someone wants to hurt themselves, or when they experience some symptoms of psychosis or any other symptoms that are bringing that crisis and driving that crisis. So we always do recommend in mental health crisis that individuals call 911. However, we are still available to help. We're still able to guide. We're still able to assist and be that support after that crisis passes. So we're able to pick up, and we're able to continue with therapy, continue with medication management, continue with evaluations, and everything that we do, that we able to support those families, we able to support those kiddos after the crisis passes. um, we work on the umbrella of Texas Tech El Paso, so we also have to follow some of the rules from Texas Tech El Paso. So we are fully operational clinic. We located in the central of El Paso, more of a downtown area, and our building is totally amazing. I think it's haunted, but it's amazing. It's historical, but you know it's beautiful. And we're here Monday to Friday, 8 to 5 Mountain Standard Time, and we able to provide those services during the regular operations. We are closed on Saturdays and Sundays, and usually we're also closed, of course, during the holidays. But we are available Monday through Friday to provide services. We are year-round program. That means that even when the schools are closed, we're still able to see kiddos, as long as the parent is willing to facilitate, as long as the parent is willing to log the kiddo in and find that private area in the house, and being able to connect them. So even when the schools are off, for example, on spring break and Christmas break and Thanksgiving break and the summer breaks and the different other breaks, we're still available to provide services. We're still available to help kiddos, and we continue with services during those breaks as well. Our services, the TChat services, are completely free, and participation is voluntary, and we provide our services. There's no charge to the families, there's no charge to the schools. So we are fully funded by Child Mental Health Consortium. So we're able to provide the services for free. So it doesn't matter if the family has insurance or they do not have insurance. We are able to provide the services. And also a lot of times with community providers, there's a wait, but we are able to see kiddos within 2 to 3 weeks. We have room to be able to accept kiddos for medication management. We're able to accept kiddos for counseling. And because Texas Tech is an educational institution, we have a lot of residents and fellows who are medical doctors, supervised by fully licensed psychiatrists. They are able to see kiddos, they're able to do evaluations, they're able to prescribe medications, they're able to continue care. So we able to see kiddos for different types of conditions and provide different types of services. So it's not just counseling, but also psychiatric evaluations and of course medication management. Can I have a next slide, please? Thank you so much. Throughout the 4 years that we've been serving our 16 counties, we had seen many different conditions. We have worked with kiddos, children, adolescents who experience different types of conditions. And some of the examples that we had seen, and some of the children and some of the adolescents that we have worked with have symptoms of depression, have symptoms of anxiety, have been diagnosed and treated for ADHD, for post-traumatic stress disorder, different types of traumas. We work with children and adolescents who have issues with the legal system, who either in or out of school suspensions, they struggle with moving up the grade, or they struggle with graduating, or they struggle academically. So we see so many different conditions. We provide services and treat so many different conditions every single day in therapy, and also in our by our psychiatrists, our residents, our fellows. So we see many conditions, we treat many different symptoms, and we provide variety of different services. Can I have a next slide, please? Thank you. Okay, this is a wonderful team. I always I can talk forever, and talking about our team and what we do. This is such a passion of mine. We do have child and adolescent psychiatrists who are able to uh, do evaluations, prescribe medications for children and adolescents, and they are able to monitor and continue monitoring kiddos for different types of conditions. We have licensed psychologists. We have senior mental health clinicians who are licensed professional counselors and who are able to provide therapy, who are able to treat some of the conditions that we see. We have residents and fellows. I know I mentioned that a little bit earlier, but we have them on rotations. They usually come in and spend 2 to 3 months with us. And then a lot of times we make a huge impact that a lot of them do want to come back as fellows, and they continue working with us. Maybe a year later, they become fellows on the program, and they come back and continue with a teacher. They continue seeing kiddos and adolescents. We have program coordinators, wonderful program coordinators that are able to help with scheduling, who are able to help with coordination of care, who are able to help with outreach, who are able to also help with so many other things that I can't even, the list is so long that they are wonderful, that they provide so many different services and serve our families in need. And we have patient services specialists who does data entry, who does also helps with scheduling and takes care of other duties, clerical duties here on the TChat unit. Thank you. So usually our point of contact are our school counselors. And school counselors, in some school districts, unfortunately, when there's no school counselors, we work with teachers, we work with nurses, we also work with um, principals, we work with assistant principals, depending on the need of the school. And also we work with some of the schools who might not have counselors, or the counselors have to rotate between different school districts because they are very, very small. So usually our wonderful school counselors, they serve as a point of contact. What that means is they are the ones who send us referrals. They are the ones who refer students to us because they are experts in their schools and they know the kiddos. They know what the kiddos are going through. So they are the ones who talk to the families about what we do and what services we provide. And they are the ones who are um, tell them how we can help them. And then, of course, the family sign the paperwork, and then the school counselor refers those kiddos to us. Um, they also facilitate appointments when the family chooses to do it during the school hours, during the day, and they are our trailblazers and they promote our services. They tell the families how we take care of the kiddos, and they are the ones who support us. And we have very, very close relationship with most of the school counselors in different school districts. And of course, when we cannot get a hold of some of the families, because of course our area code is 915, and sometimes when someone lives in a different area, they might not answer calls from different other areas. So they always tell families, hey, you're going to be getting a call from 915 number, so please answer. But sometimes when we cannot get a hold of the families, we contact our school counselors and let them know, hey, can you please help us to contact families? And they always come through, they're able to help and they're able to assist. Oh, got it. And I think I covered that a little bit in the previous one. And the school counselors, the schools, usually the ones who identify the students because they're experts in that. They obtain that parental consent because we want to make sure that we receive that parental consent, so we're able to contact the family and provide them with services. We ask for additional information sometimes if the school's able to provide us, such as 504 if the child has one, maybe some disciplinary history, grades, and things like that. And when we receive those referrals, we check the referrals, and then either myself or our medical director, Dr. Michael, we do the case assignments to our clinicians or to our residents to make sure that the kiddo gets the best care. And based on the symptoms that we see in the referrals, we're able to assign those cases from there. This is our TChat workflow, and I think this was created by Miss Adrian Harrell. So she put together this wonderful workflow, and the red building is the school where kiddos go to, and then the counselor talking to the family, everything done virtually through the computer. And then the counselor sends the paperwork to us, and then either myself or our medical director assign cases to our clinicians, and then clinicians, of course, reach out and start working with the families, providing care that we offer. So some students, we do, of course, as any other program, we have to follow a lot of rules. And some of the things that some students might not qualify for TChat services is when a parent or guardian declines to sign consent. Sometimes we have families like that, but I always tell counselors, I understand that sometimes some families might need a little bit more information. And if the family cannot, they don't feel like they want to sign consent at the moment, as long as they're willing to take a call, either myself or um, one of our coordinators, they're able to reach out and tell the family what we do and how we do it. As long as they are open to take 2-3 minute call, we can call, we can explain what we do and how we provide care. And sometimes, or a lot of times actually, it does make a difference, but when it does not, that seed is planted. I had situations where families did not want to sign consent, but the counselor, they were willing to take a call. I would call the family. They still didn't want to sign consent, but then I would get that call a couple months later telling me, I'm ready. And that is that seed that was planted several months back, and now the family is ready to sign consent and start services. So we had situations like that as well. Child might not qualify for services when the child or adolescent is already receiving services in the community. So they already established in the clinic, they already receiving therapy, they already receiving psychiatric services elsewhere, but for example, if somebody has already established their relationship with another therapist, we can offer medication management on our part. If the child maybe needs psychiatric evaluation, we're able to do that, and vice versa. So we always keep that door open for the families and for the students. Uh, when the child or adolescent is actively suicidal, we support the school. We understand that every school district have their own crisis procedures, and we respect that. But we are support system, and we can always support schools in those situations. Um, when a child or adolescent does not, when they miss appointments, and we understand the emergencies happen, but we're talking about where they maybe forgot about appointment, or maybe something else happened, when they don't cancel, they don't reschedule appointments, and usually we try more than 2 times. I think my coordinators are wonderful. They try sometimes 3, 4, 5 times before we can make that decision to close the case. And usually when the child doesn't meet criteria for our services, either coordinators, myself, or medical director, we work closely with the family to make sure that they get care that they need. So we usually work with the family to see what else we can do for them if they, for any reason, don't meet criteria for our services. Parental consent is extremely important, and we want to we always explain that to the families. We let them know the parental consent and our forms are very, very important, because we require that consent, so we able to jump in, so there's no gap, and we able to jump in and start services. So we do ask for that parental consent. That's one of the things that we do ask for. And we do different types of assessments. First time when we meet with the family, we assess for a lot of different things. Some of those are depression, anxiety, ADHD, and trauma. We want to make sure that we do that comprehensive assessment, because we want to make sure that the kiddo is being taken care of. And when needed, we also do assessments for, we utilize Columbia Suicide Severity Rating Scale, and we assess for suicidal ideations and self-harm behavior as well. Everything done virtually. We do everything through technology. Technology is wonderful. I love technology, and I think a lot of people do today. And we do everything by secure methods of communication, and we provide our services virtually. We use a HIPAA compliant platform. Doxy.me is a very, very user friendly platform that allows for um, does not require any kind of downloads. It does not require any kind of software installation. Where a child logs in, as long as the child has the family have access to the internet, they can log in on a smartphone, they can log in on a tablet, a laptop, and they can log in, and as long as they have a webcam and microphone, we able to serve them. Doxy.me could be accessed from any device, and it's a HIPAA compliant platform where provider is able to verify who logs in, and they're able to admit them into the room, and they're able to provide the service. So the person does not jump in immediately. They actually placed in this virtual waiting room, and from there they are being admitted by the provider. So it's a very, very user-friendly and very good medical platform that Texas Tech El Paso utilizes. Can I have a next one? Beautiful. Once the eligibility is determined, we contact the family's 915 number, and during the first appointment, we always ask that a parent or guardian joins the student, of course, and one of our providers. Sometimes school counselors also stay and they share some of the information with us, but it is very, very important. We strongly, strongly encourage that the families join, and they can join from any location, because the beauty of technology, they can click on the same link and they can log in, and we can do a group um, of several different people. Doxy is amazing in that way, where we can have a group in there where the parent can log in from home, the child might be in school, and the provider is 8 hours, 6, 7, 8 hours away in El Paso, and we're able to conduct the sessions. We strongly encourage parental involvement. We always want to make sure that we keep children, parents, I apologize, in the loop. We want to make sure that the parent is involved. The first session we ask that the parent joins, and then the following sessions we do check-ins with the parents, letting them know how things are going. We'll always encourage parental involvement for younger kiddos to make sure that we able to provide effective care, that we're able to engage children. So we do strongly encourage parental involvement in all cases. Medication management part is one of the things that we also provide. We're able to do that. Our medical director, our psychiatrists, our residents and fellows provide medication management. They do comprehensive evaluation. They're able to prescribe medications. They work with the family, and they able to take care of that medical portion when there's need for that. And I have a next slide, please. We can skip this slide because that's more of a medical in the way. We can skip this one as well. And some of the key points that I wanted to mention before wrapping up. The teach out services are free. We are free. There's no charge to the family. There's no charge to the schools. We are here. We are available. There's no waiting list for us. We don't have to place here in El Paso. We don't have a waiting list. We're able to see kids, some of them as soon as next week. The process of the paperwork, we usually take about a week to process the paperwork and being able to move forward. On average, we do provide 5 sessions, but we do have additional funding available where the child needs some extra care. We have other programs under the umbrella. Under the umbrella of Texas Tech University Health Science, where we're able to provide virtual services as well. When the child adolescent needs continuity of care, our team members work with that family to be able to connect them with services, outpatient services. We're able to provide them with services in the community, and we're able to make sure that they continue what we started. They continue with their therapy, they continue with medication management, especially when that was needed. So we also work very closely with CPAN program that we have here, to be able to assist in and help kiddos to continue what they need to continue having that care, to continue the care that they started here. Next slide, please. If the sessions are used, we upon completion, we usually, if no continuity of care is needed, we close the case. But if the continuity of care is needed, we able to refer kiddos out, and we work with the family to take care of that. So therapeutic relationship between the therapist and counselor and the client it contains abundance of confidential information. We want to make sure that we protect confidentiality, but we also know that our schools and our school counselors and different independent school districts, they are liaisons between us, between teacher and between the families. So we want to make sure that they remain included. We always want to make sure that we are able to work with them, and we're able to collaborate to make sure that we also keep our partners in the loop. So that is what consents are needed for. So when the family signs that consent, we're able to work with the schools and school counselors to make sure that they also remain involved in the care of the students. And this is one of the things that we also want to promote. We want to make sure that we develop that rapport with the families. We want to make sure that we develop rapport with the kiddos. So we also want to, and every time I work with the family or with the kiddo, I always let them know that everything that we do here in this setting is confidential, with the exceptions of some exceptions that I always go through. If if they thinking about hurting themselves or somebody else, or taking their own life or somebody else's life, we do have a legal obligation to get them help. And I always talk about it at length in the very, very beginning, but we do want to make sure that we protect confidentiality of the kiddos, and we help them as much as possible. We can skip this, I think, to save a little bit of time. I wanted to also let some of you know that we do provide additional training support for parents. We provide additional training support for students, and we also provide additional training support for the school staff. Um, I I do a lot of outreach in many different school districts and travel quite a bit to be able to go to different communities, to different school districts to help to be able to provide trainings, to be able to provide support, any kind of educational or any kind of mental health related topic support. It's something that we do. I'm very, very passionate about doing presentations and trainings and help from that area. So that is something that we also provide, and we do so many different presentations and so many different we support school districts to make sure that they feel supported in that area. I know I have Miss Riviera is one of the school counselors in San Felipe del Rio. She joined us today to be able to also speak from her perspective. I think I traveled to Del Rio quite a few times, and we were able to meet in person, even so we live about 8 hours away. But it was amazing to just meet somebody in person after seeing the seeing each other on Zoom for so many times, but or seeing each other virtually so many times. But it's an amazing experience to be able to connect in person, and to be able to go and just see and connect and continue that relationship. And this is our contact information. This is our phone number. This is our email, our direct email, and this is also our website where you can find a little bit more information about what we do, how we do it, what services we offer. And I am always available to be able to respond to emails, to be able to take a call and explain what we do and how we do it. And if at some point you all have questions, please don't hesitate to reach out. I'm going to put in the chat my email. And so if at some point you have any kind of questions, please don't hesitate to reach out. We cover a large area. We provide services to a lot of kiddos, and we're here to support. We're here to help. And if any of the schools, any of the school counselors, any representatives from the schools, teachers, administration need any mental health related education, we are happy to help there as well. So I will put my information in the chat so we're able to support in that area as well. I am going to stop talking right now because I think I took so much time, and I want to apologize, but I'm super passionate about what I do, and I can talk all day long. So I'm going to stop right now, and I can take any questions, or we can wait until the end. So thank you so much again for having us today, and thank you.
Okay. All right. Good morning, everyone. I'm Jen Cole, and I work with the Baylor TCHAT program. And I will echo several of the things. I think Rachel and Hannah did an excellent job. So I will be very brief and talk a little bit about our process and where there may be some differences. I work primarily with the Baylor College of Medicine, and then I have a side role where I work with the statewide programs. But I'm very excited about my work, and I think TCHAT's an amazing program. I've been working with it since the beginning, so it's been really an amazing journey to be on. Okay. Oh, next slide. I was changing my slides and they were not changing. Okay, so as Rachel mentioned, the state's divided up. So Baylor serves Harris County and some of the counties north of Harris County. These are the current districts that we do have MOUs and we do provide services. If you do not see your district here and you are interested, please reach out to Jessica Franco, whose email and phone number is up there, and I will put it in the chat. I think as Rachel said, we are very interested in providing services. These are free. That's consistent across all of our HRIs. We do provide the range of service, therapy, medication management, psych evaluations, things like that. So we would be very happy to partner with you. Next slide, please. So again, this just kind of echoes some of the things that were highlighted by Rachel and Hannah. We provide virtual appointments with licensed mental health professionals. We do have the gamut: LPCs, LCSWs, LMSWs, psychiatry, folks that work on our team to do a really thorough evaluation of our students. All of that is free. As Hannah mentioned, we don't have the facility to provide coverage for the cost of medications, but we do work with families to try and identify if there are coupon programs or other things like that that would help support that if there is medication that's prescribed. We are designed to be a brief intervention program, but again, we recognize that if something is identified that we are not able to work with the family, we do work with them to make sure that they get connected to a service that would be able to provide that more long-term care and support. Just for our Baylor program, this is what we look at. We ask our excellent school staff to identify a student that needs our services. We ask that you let the parent know that they're going to be referred, and we have some information that we make available, flyers in English and Spanish that can be shared with our families. And then we ask that the student is referred through our trait platform. For our program in particular, we don't ask our counselors to try and get that consent paperwork. There's no additional forms. We really do ask just that they submit the information through trait, and then our team will reach out and they'll coordinate. They will collect any consent information or any other additional paperwork that's needed. And so we do really want to make sure that it's as smooth as possible, and that process is as easy. We just do ask that our counselors let the parent know that the referral has been made. You receive the referral, our team reaches out to the family usually within that day or the next business day. We call them, we talk to them a little bit about the program, what they can expect. We collect any paperwork that we might need, and then we schedule them an appointment. As Hannah mentioned, we are usually able to schedule an appointment within a week or two for both our therapy and our psychiatry teams. We don't have any type of wait list, and it's usually fairly quick that our families can get appointments. A lot of it might depend on their schedule, what's convenient, on-campus appointments, things like that. We provide intervention, and then we assess for any type of care coordination that might be needed. These are some things that we can help with, and that some of the things that we can't. As Hannah mentioned, I think as Rachel talked about, we aren't a crisis service. So if there's a student who's experiencing active suicidal ideation or active psychosis, we do ask that schools implement their crisis protocol or call 911 as needed. We aren't able to do psychological or neuropsychological testing or custody evaluations. Those are things that usually are better fit for longer term care providers. But again, we can help navigate if our teams or our families identify that as a need. Our referrals must come from the schools. And as Hannah mentioned, we work with public and charter schools that are in our catchment area. And then again, the reasons for referral are very similar: anxiety, mood, sleep. If you're seeing increased isolation, changes in behavior, grief, relationship, or bullying, those are all things that our team is able to help support. And as everybody talked about, we offer education opportunities. So we're able to schedule presentations for parents, students, teachers, counselors, and we can gear that to our audience. And we can do several different topics, including just general mental health awareness. What is it? Why might you be referred? How can counseling or psychiatry help you? And then we also have some things that are targeted more specifically at things like managing bullies, dealing with anxiety, different coping mechanisms, managing stress. We also have a great presentation that we do looking at trauma-informed classrooms and how to create some support in that environment. So those are all things that we offer, again, free of charge as part of our TChat services. Our partnered school districts can actually just reach out to us and we can get those things scheduled. So I know I went really brief and fast, but I want to get to our counselor panel because I think it's just a great opportunity for y'all to hear from them. These are our hours and our contact information. We do have interpreters. We recognize in Houston, Harris County alone, there's over 140 languages spoken. So we do have some team members that are bilingual, but we also have access to interpreter services for our families. So that we don't want that to be a barrier for them to receive care. And we are Monday through Friday. We are also year round. So even though the summer tends to typically be slower, we are able to still accept referrals. If there's summer school or things going on, we are still able to receive referrals and get those appointments scheduled. So with that, I'm going to put contact information in the chat. please feel free to reach out with any questions that you have, if there's anything that we can help with, and I'm going to turn it over to our counselor panel.
All right. Thank you so much, Rachel, Jennifer, Hannah. Appreciate that very, very much. And as I discussed, there are specific HRIs. Again, TCHAT is a statewide, and some the HRIs do things differently. But you can get with your HRI and find out those questions or differences. All right, so I want to jump in to our wonderful panel that we have here with us today. So you've gotten a chance to hear from the state offices, two of the health-related institutes, and now we have the boots on the ground counselors that are doing the referrals to TCHAT. So I want to welcome everybody, and I really appreciate you being here. So to kind of start off really quickly, let's do a brief introduction of name, district, and the level of campus that you serve, if you don't mind. So we'll start with Becky.
I am Becky Kemp. I'm in Conroe ISD at a 5th and 6th grade intermediate. So we serve between 10 and 12-year-olds.
Thank you. Jennifer, do you mind?
Hey there, everybody. Jennifer Bruff. I am in Tomball ISD, and I work with kinder through 4th grade.
Excellent. Erin.
I'm Erin Temlitz, and I am a counselor also in Tomball ISD at Timber Creek Elementary, and we serve kindergarten through 5th grade at our campus.
Thank you. Adrian.
Hi, I'm Adrian Metter. I'm at Stockton Junior High in Conroe ISD, and we serve 7th and 8th graders, so like 12 to 14, sometimes 15-year-olds.
And Monica.
Hello, my name is Monica Rivera. I'm a counselor at Del Rio Freshman at SFDR CISD here in Del Rio, Texas. We service freshmen, so they're about 14, 15 years old.
Okay. Well, thank you all for being here, and I really do appreciate it. So I'm going to start out with our first question. If you'll kind of describe your student mental health referral process, and then talk a little bit about how TCHAT has changed how your students receive mental health services. Okay. And I'm going to kind of open it to anybody that wants to start.
I'll take this one because it's been a game changer for Del Rio. We're actually, I love how Miss Hannah said we're a unicorn. Del Rio's we're about 100 and I think 60 miles from San Antonio, which would be our nearest big city. Del Rio does not offer a lot of mental health resources. We don't. We have very, very few here. I think the only psychiatrist that we do have, she's also through virtual, she's telemedicine. But a lot of our families, we're a Title I district, so a lot of our families can't afford to make the trip to San Antonio or, and it's a long wait. I mean, it's going to be a month and a half to 2 months before you'll get in. So TCHAT's been amazing. We're able to get our parents in, our parents on board, our students in. It's free of charge. We're able to help facilitate the meetings here. So, I mean, because they may not have access at home to what they need to get on. So for Del Rio, it's been amazing. But we go through the counselors. We have excellent contact with Dr. Garza and her team. They're great about responding, getting us in quickly, especially if it's an issue that we really feel the student needs help. So we absolutely love it. We're huge supporters and we're grateful for TCHAT.
You, Monica, I appreciate that. Does anybody want to add to that?
I will totally add to that. Like Monica said, it really has been a game changer for us. It's been a really awesome introductory experience for families into the world of mental health and counseling that basically eliminates barriers as far as cost, location, insurance, time. It's just incredible to have that access for families. And so then they have an overall accessibility, which is great. And then the kid receives services that they need, and it's just fantastic. As far as the referral process, we usually identify it, the individual counselors will identify, and we recommend to the families, and they're usually very welcoming of any sort of help that is especially free of cost, but also doesn't require them to take off of work or find a way to get their child to a specific location at a specific time. And so they just are like usually very excited to have the opportunity to get some help. And it's like a relief usually for the families. And that's been really great to be able to offer that as an experience for them.
Thank you, Adrian. To kind of back up that question, do you feel like TChat has kind of helped bridge the gap or maybe even complement your existing mental health services for the students?
I'll go ahead and answer that one. I absolutely think it's been a great resource for us. Being at the elementary level, there's one of me for almost 900 students, which is a whole nother issue. But it has really helped me with those parents that are struggling and students that are struggling. It gives me something that's more immediate, because we do have a lot of resources in our area, but the wait lists are very long. And I have found that when parents get to me, in their mind, it's a crisis type situation, and they so appreciate how quickly TChat can connect with them.
Thank you, Erin. And anybody else want to add to that, or?
I'll add.
Oh, go ahead.
Coming off of COVID, there have been long wait lists, 15 to 18 weeks. That's so long. And TChat has been really great because we were able to get people in, and I could tell them, you know what, they'll see you in about a week, probably, maybe 2 weeks at the most, but your child's going to get some attention in the next couple of weeks, and they're going to get with you very soon to set that up, do an intake. And I think I agree with what everyone said. It was a relief to a lot of our parents that they were able to get in and issues be addressed so quickly.
Thank you, Becky. Jennifer?
I just wanted to say that from my experience, this is my first year using TChat. I am happy to see that my old district is on y'all's list now of districts receiving those services. I'm excited for those kids. But for me, I love that the parents get to be a part of it. They get to come in and sit with their kid during those sessions, or if they are a working parent and they can't be a part of it, they have that, that capability of, I can still work, but my kid is still getting mental health services that they need. So it's kind of like, it gives them both options, where I know for a lot of parents that kind of calms some anxiety about getting counseling services and getting in to see a therapist. So I have liked that.
Excellent. Thank you all very much. So this next set of questions is going to talk about barriers. Because of course, anytime you implement a new program, nothing works as perfectly as it should. But I know that each of you have experienced barriers and you've overcome them. So the first question is, talk about some of the barriers that you might have faced implementing TChat, and then how have you overcome them?
I'll speak again. Oh, go ahead. Go ahead. I'm sorry. My barrier that I have identified is parents are eager to want the services if their child is needing it. Either the parent will reach out to me or I will reach out to the parent to offer these services. The barrier has been parents following up with that referral process. Either they're not getting the emails, or they're not answering phone calls. I'm not sure of which it is. But then working alongside a veteran counselor that is here in our district, Erin, has given me ideas of how to kind of bridge that gap with parents, of reaching back out to them and say, hey, don't forget, TChat's going to be reaching out to you, kind of helping be that liaison between TChat and the parent to make sure the kids are getting those services.
Thank
Right.
you.
And to go along with what Jennifer was saying, like we have that as well at times. And yeah, the best thing to do is to continue to follow up with the families and encourage them to communicate with TChat. I actually have the TChat number saved on my sticky notes on my computer, so I can always give that out to the families and they can just call them, and it's just a lot easier for the families to directly contact. The other barrier is we actually offer on-campus counseling options for TChat sessions. So the barrier there is finding a space for it, and making sure it's a secure private area. So the way that we combat that is we have it set up in one of our conference rooms, and then we block off, we have a calendar that blocks off that room. And then we just try and watch it like a hawk whenever there's a kid in there with the sign on the door that says there's a Zoom in progress. And so we just make sure we are cognizant of that and make sure we reserve the space. But it's definitely, you have to be very intentional and make sure that there's a spot for that child.
Thank you, Adrian. And that kind of brings me to my next question that I hear from others. One of the questions that is, I think it was even asked on here or addressed, and others that I have heard is how do y'all handle, are you as a counselor in the room with the child? Do you do like Adrian does, where you have another space? Talk a little bit about how that is executed on your particular campus when the children are receiving T-chat services.
I can go. Mine will be a quick response. We do not have families come on campus yet. We've not had to do that. The one of the referrals that I had given was a student with high anxiety, and she was not wanting to come to school. So it worked out perfectly to have the sessions at home. So our parents will, and T-Chat will schedule those sessions that are convenient with the parent and the student so that they can do that at home. So we haven't so far had them come on campus yet. But that's not, I would love to do that if we have a case that arises for that.
So I'll share what we do at our campus too, being an elementary campus. Depending on the age of the students, we have sometimes the parents will come up for the sessions with them. If they're older, I've figured out how to make it work. So I send them the link and the kids bring their Chromebooks down and we're able to log in and they have their sessions in a private area. But one of the things our parents have really liked is they don't have to check the student out of school. So it's not counting against their attendance. We just call them down to the office. And that has been a really big selling point for parents. And it's also sometimes it's our parents who are struggling. And so it gets them up at school where I can kind of touch base with them or talk to them for a minute before or after. And I think it makes some of our parents feel more comfortable at school and feeling like they can be open with us and build that relationship. So that's been an unexpected but very delightful perk of having T-Chat.
Awesome. Thank you. Anybody else want to share?
I was just going to say that predominantly most of our kids do their T-Chat sessions at home. I see a question in the chat about, so T-Chat can be done just at home? Yes. Predominantly, it's mostly at home. It is like a case-by-case basis if we do it on campus.
Most of ours are done at school. It's very, very rare that we have any done at home. One of the only cases I know of at home is this, and it works because El Paso is an hour ahead of us or behind us actually. So like we've had students say, okay, I'll do it, but I'll only do it at home on my cell phone, which is great because it's a link. It's really easy for them to log in. I put my own daughter through the program when she was a senior in high school, and she refused to come in the house, so she would do it in her car on her phone, and that worked. I mean, as long as she went to her appointment. But for 96% of our kids, it's done here on campus. We put them in a room. That first appointment, Dr. Garza, they require a parent present. So the parent will just check in through the district protocols, and then we'll let them have that hour in the room by themselves.
Okay, thank you. Tell us a little bit about how have the students responded to meeting with somebody virtually? Have they given you any feedback and do they respond well?
I'm going to take that one. I think our generation, we prefer in person, but this whole new generation with everything with technology, they're okay with it. They probably prefer it because it's I guess maybe that's because I know a lot of the kids will do like at home, they'll Zoom each other in groups. And so for them, it's really not a big deal. Just wanted to throw that out there, but they like it. We've had students come back and actually request, like I received T-Chat last year when I was in 8th grade. I'm really struggling again with XYZ, and we can set them up again. So the students have been more often than not very positive, and they like it.
I will say I'm sorry. I was gonna say that's also true with the younger grades. Like sometimes they'll just show up because they remember. I may have it on my calendar, but I may forget. They never forget because they're looking forward to that.
I was going to say the same thing. I have kids as young as 2nd grade that are in T-Chat and they're eager. They're so excited when I show up to the classroom, like, oh yeah, it's my counseling appointment today. Like they're excited to get on and talk with someone. And then I have a parent who's concerned and she loves coming in. Like she'll email me and say, hey, don't forget we have, so-and-so's appointment today. And I email her back, yes, ma'am, I got you ready to go. And I utilize, either a classroom that we have that's empty or our conference room as well for those private sessions.
Excellent. Thank you all. All right. So, within our school systems, we have a lot of diversity of students as far as the languages and things of that go. Will you talk about, has language been a barrier with getting a provider who speaks that particular language?
We're a border town here. We're just a few miles from Acuña, Coahuila. But we actually have a copy of all the same consent forms. We have them in Spanish. We have the flyers in Spanish, and we have both readily available. So Dr. Hannah's, we just send it in. We let them know our parent's a Spanish speaker or our student prefers Spanish, and they arrange on their side to make sure that counselor speaks that language. So we've had no issues with the language.
At my school, we're high Title I and high Hispanic population, and it's been very easy with the consent forms. And then when you're getting on trait, just like Ms. Rivera said, you just indicate whether the parent prefers English or Spanish or the child prefers English or Spanish. And I know that drop down has different languages in there as well, but ours has so far just been English or Spanish. So it's really convenient, and it's been hard to find in our community Spanish speaking counselors. That's, they'll email out, and say, hey, this new counseling office has opened up and we want you to refer people. And I'll email, hey, do you have a Spanish speaking counselor, a bilingual counselor? And they're like, oh no, I'm sorry. And so I'm like, okay, that's not going to help me very much. So it was really nice to see that option when you're signing parents up, and to have the consent forms in English and Spanish.
Thank you all. Appreciate that. Now, talk about a time when a student and their family maybe shared some success that they had with TChat. Of course, keeping everything, confidential and all that good stuff, but any success stories that you've heard?
Okay, I'm going to take that one. So we had a student who, and it was right during the pandemic had just started. I was working with 6th grade at the time, and she had extreme anxiety. Like she was always turning, because everybody was online, everybody was virtual. I could not get her to attend to Zoom. Like she would stay off the camera, she wouldn't answer. She was very smart and she was there, but she did not want anybody to hear her. It got to the point where teachers would call me because she would be crying like on the side of the computer because she did not want to partake that way. Like it was very nerve-wracking for her. We referred her. Everything changed for her. It just took a few sessions, and I believe they actually did prescribe medication for her anxiety. And she stuck with it. She took her medication as prescribed. I saw her at the end of that school year in person, and she was a whole different kid. She wasn't having any issues there, so she needed that medication. But that one was really awesome to see just how far she'd come within those few months.
Thank you for sharing, Monica.
I'll go next. I had a kiddo this year who had come in with a prior loss of a parent, and when I was speaking with mom, we were talking about everything, and I suggested TChat as a resource. And he's actually one of our kiddos who does utilize the on-campus option. So they'll like email me and be like, "There's a session on this date," and then he'll come in and we'll do that in the mornings. And I don't sit in there with him; he just does it on the computer. And it's been great to see his progress over the last several months, because there was another loss in his family around the same time and earlier this year. And so it's been great to have that accessibility for him, and that option to give that to the parent who isn't able to take him anywhere, like during the school day, that he can access that. And he's definitely been like benefiting from that. It's been great to see.
Thank you, Adrienne. Anyone else? All right. Go ahead, Erin.
No, go ahead.
Okay, well, I was going to kind of switch gears as we have about 10 minutes on the clock. Before I do that, is there any other, but let me let me back up. Before I start the Q&A portion of the webinar, is there any other anything else that you'd like to say to the participants about your experiences with TChat?
I just want to say that it's been a great, easy resource to provide families. It's usually my go-to first resource option because they will provide that additional like references for further care if needed after those initial sessions. It's just been fantastic to have that as a, like, here we go, we got all this, it's already printed, here you are, and get them signed up for it quickly, and the turnaround time is very fast, and it's great.
I was gonna say, I appreciate how responsive TChat is. When you ask something or we've got that connection with the different counselors that are working with the kids. And it's, if I email something, I get a very quick response. It's not like I'm waiting days and days. And I've heard nothing but good things from our parents. And so that to me just makes our job so much easier.
I love that they keep me updated. So I referred someone and then the family ended up finding a different resource on their own. We're required to provide or we do provide at least three resources for them. But the parent was, we wanted to get them in as quickly as possible. But I was updated really quickly on, hey, we got with this family, we were unable to help them. They had a different resource, let us know if we can do anything. So I really like the updates. I like getting that information really quickly so I know if they're getting services or not.
I don't know if anybody else in our chat is familiar with it, but we've actually had students diagnosed through TChat. They'll send us a letter and they'll tell us, so-and-so has ADHD. These are the accommodations we recommend. But with that letter, with that official diagnosis from a doctor, where somebody might not be able to get that referral immediately from somewhere else, because sometimes our pediatricians will refer them out as well. So it's neat because then it moves that process so much faster for us here.
Thank you. All right. So Rachel and Hannah and Jen, I don't know if you want to come back on for this. We're going to do just a kind of a quick run through of some of the questions that came on. And I'm going to actually go out of order of my questions, and I'm going to hit because Monica touched on something. One of the questions that I had is with the services that TChat provides, and I think Monica's already alluded to it. Does the TChat providers, can they assist with, I guess, the diagnosis, the medication, 504 paperwork, special education paperwork, like other health impairment forms, those kinds of things? If you don't mind kind of addressing that as a whole.
I can jump in and definitely to say what Miss Monica mentioned, we provide a diagnosis, formulate the diagnosis, and then we are able to provide that letter stating that we work with the child from this date to this date. This is the diagnosis that we formulated based on the treatment that we provided. Those are out, and the following are our recommendations. And we've worked this sometimes certain forms that every school district has, and we're able to fill out those forms as well to accommodate and to help with the 504 IEP accommodation. So yes, we're able to do that, and we have been doing that. And sometimes kiddos need a little bit more support. So our psychiatrist able to fill out some additional paperwork to help children with other types of accommodations in the community. So we're able to do that.
Okay. Thank you. Thank you very much for that. Another question, I think it's been answered in the chat, but I just want to make sure that everybody is understanding of this. Talk a little bit about the location of services. We heard that some are getting services out of school, some during the school day, and I know there is flexibility within that, but if you wouldn't mind kind of speaking on that.
We provide both. We provide appointments during the school hours, but we're also able to, and because El Paso is a unicorn, 8 to 5 for us, it's a 9 to 6 for many other areas. So we're able to provide the latest appointment would be 4 o'clock here in El Paso, it's 5 o'clock elsewhere. So we're able to actually provide those appointments as well So sometimes certain appointments are done at home, sometimes they done at school. And like, for example, during the summer, I know sometimes there's some counselors who do work summer schools, so they're able to facilitate appointments, but a lot of times we do provide appointments at home as well.
And I do think
Rachel?
this is something that varies across HRIs. There are some HRIs that have those evening hours, so they're able to accommodate more at home. There are some HRIs that really primarily focus on school-based appointments. So it's not something that there's some variation across the state.
And because we are under the umbrella of Texas Tech, we have to follow certain rules, and we do not provide evening appointments because our clinic is operational 8 to 5. But because we are located in Mountain Standard Time, we kind of dip a little bit into the evening appointments, especially for those who reside in the central time zone.
We do have districts with some constraints, and work with them if they don't have the space, or staff availability, or other resources to provide those services on campus. But again, that, as Jen mentioned, that does vary based on the HRI.
Okay, thank you all. One last question, for the time is quickly approaching to the end. If your district has an MOU with TChat services, but your campus isn't receiving those services, or they don't find their name on a list or anything like that, can you give advice as to what the staff members should do?
Talk to their
Yeah.
district lead. Sorry, Rachel, go ahead.
Yep, that's what I was going to say. Talk to your district lead. So if your district's already active, you should have a district lead that is in contact with your HRI. We, like I said, we really want to be in 100% of all schools. So we really encourage you to work with those district leads to help bring your campus into an active status.
Hey, thank you all so much. We are nearing the last 3 minutes of the webinar, and I really want to reach out and thank each and every one of you for joining us to learn more about TChat today. I'm going to share my screen, and this is okay, there you go. You should be sorry, I can't talk. You should be seeing a survey for kind of our post survey. And this post survey goes with the pre-survey that happened before. We really appreciate if you take the time to do that for us right now. So with that,
Yes.
Ashton.
Yeah, no, I just wanted to say thank you to all of our colleagues who are in our health-related institutions doing the great work of TChat, and of course our school counselors in the field. Like, I wish I had like one of those like clapping machines just to show y'all as much love as I possibly can for all of the work that you all do. So thank you to our counselor panelists. So as you all are completing this post-training survey link, this post-training survey, I also want to direct you and let you know that the recording for today will be posted on our schoolmentalhealthtx.org website. We'll put the recording up there along with any of the links that we shared today. We also have another webinar session next month that will be all around community partnerships as well. And as we approach 12:30, you all are welcome to go. But I'm also going to turn it over to my colleague, Jerlene, who has a few announcements for us as well. Oh, I think we might have lost Jerlene.
Oh, here, I don't mind jumping in, Ashton, to kind of talk about that. You can subscribe to the TEA Mental and Behavioral Health newsletter by using the link that's going to be put in the chat, and then you select the Mental and Behavioral Health tab. So you can also select other TEA topics that interest you. And we're going to continue to provide information on future webinar sessions and all sorts of good stuff that is going on through those newsletters. Okay.
Yes. And then we also put a link in the chat for you all to provide some feedback for us as we work on updating our school mental health planning guide and toolkit. So please, if you all feel so inclined to do so, give us some feedback on our planning guide and toolkit so we can update that for you all for version 2.0. And again, thank you all for your time, and we very much appreciate you.